Okay, hello, welcome back again. Okay, what to expect when pregnant? You scared? Okay, so now there are a whole lot of things that comes with pregnancy. Okay, so remember what we said previously. Now this is the deal. What do you expect when you're pregnant? What are the procedures? What is in for me when I am pregnant? What should I expect? What should I look in for? So sit back and relax. We're going to be looking at all of the things as it entails what pregnancy. You're going to be knowing what ante-natal is, what post-natal is, childbirth and all of that. Now these and more we would be looking at in this what in the course of this class. Now that brings us to our topic for today, which is pregnancy and childbirth. Pregnancy and childbirth. We will be looking at pregnancy and what? Childbirth. Now, before we progress, there are some things you should look out for. Now, before this lesson is over, the class is over, you should be able to explain the meaning of pregnancy, ante-natal, and post-natal. You should be able to know what these things mean. So when you hear them somewhere and someone is talking about them, you should be able to relate because you now know better. Now, another one is that you should be able to state the signs of pregnancy. You'll be able to state the signs of what? Pregnancy. And also you would be able to describe the different necessary preparation for childbirth. Now, when you have known the signs of pregnancy, you now know what the measures or the steps you need to do what to prepare for the newborn as he or she arrives planet Earth. So these and more we would be considering as we progress for the class today. Now, children are very, very important in our society. People love children, and as couples get married, everybody is expecting them to have children, and they can be great joy to the extended family. When the daughter or son calls home and say, "Oh, we're having a baby," everybody's excited and everybody's looking forward to what? The arrival of the baby after the marriage. Okay, now children are expected to do what? Carry their family's name, and then they're also to look after their parents when their parents are old, okay, at old age. Now this is why people have children. Very, very important, okay? Now it's always a welcome news, like good news for every other member of the family, because when they hear that a baby is on the way, everybody's excited and they look forward to when the baby is going to be born. Now, pregnancy is as a result of the fertilization of the female ovum, okay, or egg by the male cell or what? Sperm. Now, pregnancy occurs when what? There's a fertilization, in the female ovum by a male cell or sperm. That's when one can say one is pregnant. We talked about menstruation when a woman stops seeing her menses. Okay, when menses stops, then pregnancy has occurred. Now, this happens when there's a fertilization by the male cell or sperm. Now, I want to go into a little bit into biology again. Okay, now let's talk about the male reproductive organs. Let's talk about the male reproductive organs. Now, a male reproductive organ is made up of what? The two testes, okay, which is enclosed by the scrotum. Now, this is what a male reproductive system entails, or what it has. Now, two testes. Then we have the sperm cell, the spermatozoa. We know we said pregnancy is the fertilization of what? The ovum by the sperm cell. So the spermatozoa is also the sperm cell. Now, this is the male sex cell. Sperms are produced in the testes. Now, that is where they are kept, and then they're produced from the testes. Then we have the seminal vesicles, right? Sperms are stored when they are ejaculated now into the female. Okay, now in the course of when if male and female is having what? Intercourse, having sexual intercourse. Now the male tends to do what? in the course of the sexual intercourse tends to do what? Ejaculates. So that process of ejaculating is when he passes on the sperm cells into the woman's ovum. Okay, now we also have the prostate glands in the male reproductive system. Okay, now this secretes liquid in which the sperm cells are what? Suspended. I'm sure you have a background study of what the male reproductive system is. If you want to learn more, then you need to further into your biology to learn more on the male reproductive system, so you can be able to know what flow with what we're saying. Now let's also look at the female reproductive system, some of the things that are particular with the female reproductive system. Now we have the vagina, which is connected to the uterus, and that leads to the vulva. Now the vagina is the opening that it's in the woman where the man can come into contact when there's when the sexual intercourse. Now we have the ovum or egg. Now it is the female sex cell. Now that is where we said fertilization takes place, when the male cell or sperm goes into. Now we have the 2 ovaries, okay, each of which produces 1 egg every month. That's what happens when you're menstruating. Okay, now when an egg is produced, because there was no conception, that process is called what? Menstruation. Okay, now when there's conception and an egg is not produced, that means, okay, pregnancy has occurred. That means the woman is pregnant. So menstruation would do what? Would stop. Now also we have the 2 oviducts of fallopian tubes, now each leading from each ovary to the uterus. So the female reproductive system has something that is called the 2 oviducts, or what? The fallopian tubes. I'm sure you have an abstract idea of what the female reproductive system looks like. Now let's progress into the business of the day. How pregnancy occurs. How does pregnancy occur? Now each of the ovary produces ovum every month, like we said. And then the process of producing ovum by the ovary is called what? Ovulation. Now, ovulation is the period that says the woman is fertile, is the most fertile period of a woman. And when that happens, and the sexual intercourse, she's going to do what? She's going to get pregnant. Now, if there's any form of sexual relationship with the opposite sex, and the woman is at that period when the ovum is produced, the sperm will be fertilized by the ovum. It is going to be fertilized, and then the woman is going to be said to be what? Pregnant. It's going to result in pregnancy. And then menstruation would do what? Would stop. And then, of course, she's on her way to having a baby. That's what happens. That's how pregnancy occurs. Now let's look at the signs of pregnancy. The signs of pregnancy. Now, what are the signs of pregnancy? The first thing is that menstruation will stop. When a woman is pregnant, her menstruation will stop. So she won't be seeing her monthly flow every month where you have to menstruate. Menstruation will stop at this point in time. Another one is that there may be frequent urination. You have to go and urinate most times, frequently, that's what happens when you are pregnant. These are some of the signs of what? Pregnancy, when a woman is pregnant. Another one is that the abdomen enlarges for about 3 months. That's what happens when a woman is pregnant. These are some of the signs. The abdomen enlarges from about 3 months. And also, as the pregnancy advances, the mother may feel the baby's movement. Now, when she progresses from the first trimester to the second trimester, okay, she's going to feel movements. She's going to see the baby moving, and then, when she touches her belly, she can feel the baby move. So these are some of the signs of pregnancy. And also, when you visit the hospital, because you feel uneasy and all of that, you can be tested, with blood. Your blood sample can be taken, and then you can be certified that yes, you're pregnant. Because most times menstruation can stop, and then for some other health related issues, and then you're not pregnant. But if you run a test, you can be able to ascertain if truly you're pregnant or not. Now, when one is pregnant, there's something or there's a process you have to go through to take care of yourself, and that process is referred to as what? The antenatal what? Care. Antenatal care. Now, antenatal or prenatal care is the care required by a pregnant woman before the birth of her child. Now, this is going to be done by a doctor or nurses. You have to go to the hospital. You have to let them check you. You have to let them see you when you are pregnant. So they will check you, check your blood pressure, take your urine sample, check your blood, and all of that. Now, in the course of your pregnancy, you have to be going for antenatal. You have to be going for checks. Now, this is very, very important because that this process, they will be able to discern if there are abnormalities in the course of your pregnancy. So it's very, very important that you should go for antenatal care. Now, what are the procedures when you go for antenatal care? Now, your regular visits to the hospital or the clinic, you have to go. They'll take your urine test. Every day you go, take your urine test. So before you're going for antenatal, you have to urinate very early in the morning, and then you take the sample to the hospital. Also, they'll do blood tests if it's necessary, and then they'll check your blood pressure. They check your blood pressure. Very, very important. When a woman is pregnant, they have to always check for blood pressure because it can cause it's not a good sign when a woman is pregnant. And also they have to weigh your check and then to see how far you're going. Hope you're not you're not going to be too weighty and all of that, not overweight and none of that. Then also abdominal examination. The doctor is going to be checking you. You're going to lie down and we're going to be checking the baby and all of that. Also, they will check pelvic assessment towards the end of the pregnancy. Okay, they will check everything. These are some of the routines as you go for antenatal. So when there's an issue, they will be able to discern it early if it's something they can handle or otherwise. Now, what is the importance of antenatal? Why is it important for people to go for antenatal? I hear a lot of people, no, I don't go for antenatal, I'm not going for antenatal. And when there's a problem, they're running everywhere. But if you have been going for antenatal, if you've been visiting the hospital, you have been able to know that there's a problem. I've seen a lot of people just going for antenatal and they say, oh, the baby is going to come today, we're going to be having the baby. And then they never planned for it. But because they went and they noticed that something was not going right, they had to do, a very fast or an emergency treatment or solution to what the problem might be. Just imagine if some of these persons don't go to the hospital for antenatal, it would have been something severe that could have been avoided. Now, antenatal care is very, very important for the following reasons. First of it is that the test at the clinic can show any problems which the woman or her baby may have. Yes, might likely have. So if you go for your antenatal, you would be able to know if there are possible problems. Doctors check a whole lot of things. The baby's fertile rate, they check everything. So when it's not going like it's supposed to be, you don't know. There are specialists that know these things. So when you go there, baby can be able to know. Doctors can be able to know. So you and baby can be safe and alive. Antenatal care helps the fetus, the baby in the womb, to develop properly. So they know at every stage, the first trimester, the second trimester, the growth of the baby, what is expected. When at the second trimester, the baby is not growing as is expected, they will alert you, they will let you know. So when you go, they will let you know every stage of how the fetus is progressing. And also it helps the mother to keep fit. It helps mother to keep fit. So to know when you are overeating so you don't get hepatitis, diabetics, that comes with pregnancy, so you don't get that. And also it helps the mother to prepare properly to the child's birth. Now, when you go every day, there are lessons, they talk to you, they tell you what is expected. A lot of people are new moms. They don't have an idea. They're not even if you're not a new mom, even if you've had children, every child comes with different experiences and feelings. So you would have to do what? Learn every time as you go for antenatal. Okay, as you go, you know that this one there's a different experience with what I experienced with the first one, or there's a different experience. There are always new experiences as your pregnancy progresses. So antenatal will help you unravel and uncover some of these things that might be, a novice to you. Now, also at the clinic, you learn a whole lot. Nurses and midwives will talk to you. They'll share their knowledge on diets, good nutrition, what you're to eat, nutrition, balanced diet, and the things that are expected to help baby grow and keep you fit as well. And they'll give you ideas on proper clothing, what you should wear and what not to wear. New moms, they want to keep and look very hot and fine. They say, no, you need to wear loose clothes because of you and baby, so baby can be very, very comfortable and all of that. Don't wear high-heeled shoes. You have to go on low shoes, okay? And they tell you to avoid some things. And also regular mild exercise and enough rest. When you're pregnant, you get to know that it is very important to take rest. You need to rest very well when you're pregnant so you can actually have strength preparing you for the day of delivery. Now, why is it important to have good nutrition during pregnancy? Let's look at some of the guidelines for good nutrition during pregnancy. Make sure your meals are balanced. Very important. Your meals must be balanced so that you can actually stay healthy for you and baby. Also, extra vitamins are necessary for good health. Now, when you go to the hospital for your antenatal care, there's something they give you called the routine drugs. Now, you need to keep taking those drugs, and every day, it has almost all the supplements needed for you and the fetus. Now, you need to take a whole lot of water. Drink enough water. Good nutrition entails that you take good amount of water as well. You must take good amount of water daily. And also, she needs to take increased intake of minerals, okay, such as iron for blood, calcium for bones, and then you can find some of these minerals in your foods, such as taking milk, taking seafoods, eating fruits, taking vegetables, and then you can get them if you can supplement them all at a go. But you can eat these foods and find them they're very, very healthy for you. Now, also you need to avoid carbs, extra carbs. They're not good for you, so you need to avoid them so you don't get overweight. Now, this is not good for you as a pregnant woman, because as pregnant as you are, you're going to be adding a little bit of weight. You're carrying someone else. So if you now take too much of carbs, you would be overweight, and it's going to cause risk factors for your health. Now, what are the possible effects of poor nutrition? There are possible effects of poor nutrition when you don't eat right when you're pregnant. Now, it could cause low birth weight for the fetus. When the baby is born, the baby is going to have low birth weight. Now, the baby could even weigh less than 2 kg, now, which is not good. So you should take measures to making sure you eat right, so you don't have this having to have a baby who is underweight. Then also, different forms of malfunction in the child can occur because of poor nutrition. You don't want to go through that stress, so you have to try as much as possible. Yes, most times when a woman is pregnant, you don't really feel to want to eat a whole lot of things, but you can just try in bits because of the fetus you have inside of you to want to eat. Because if you don't take good food, you could cause malfunctions in the child when the child is born. And also, not just for the child, it could also affect the mother's health. It will affect the mother's health as well. So you need to be intentional. Preparation for childbirth. Now, when a woman is pregnant, she's looking forward for the day that she's going to have a baby, where she's going to bring forth her baby. Now, it's very important that a pregnant or expectant mother prepares for the delivery well in advance. You have to put plans together for that day that you're going to be having your baby. Now, the midwives are going to be telling you all of these things that are going to be necessary for you on that day. Now, there's some things that you're going to be taking with you when you're going to be having your baby. Now, for the mother, what are the things that she needs when she's going to be having her baby? Now, you're going to be needing sanitary pads, you're going to be needing disinfectants such as Dettol, and also you're going to be needing toiletries, toilet soaps, cream, powder, etc. deodorants, etc. The personal clothing, you're going to go with personal clothing, including nightgowns, nursing braziers, pants, and all of that. So these are some of the things the mothers would go in with when she's going to be delivered of her baby to the hospital. Now for the baby also is not left out. You need to get clothes for the baby, and then you need to get safety pins if necessary. Okay, a whole lot of the 21st century children don't know about safety pins and napkins, what they do. Okay, now you need to get napkins or nappies. Today we have Pampers, we have nappies and disposable nappies all around. People are not made to know about what napkin is, what people usually use at that time before disposable napkins or diapers came around. And also we have towels for baby, then the baby's comb, toiletries, baby soap, oil, lotion, powder, a blanket or a shawl. You're going to take all of this for the baby when the baby is going to be born. Now after the baby is born, now you have something that is called postnatal care. You remember what I said earlier, antenatal care? Now we're looking at postnatal care. Now postnatal care is the care required by a mother after childbirth. After childbirth, this is important that she takes care of herself as well and the baby. So after 6 weeks after childbirth, the nursing mother and the baby would have to visit the hospital for postnatal clinic for checkup, to see the doctor. Now at the clinic, they're going to be checking out some things. The mother is going to be examined by the doctor how she's faring after childbirth, hope no complications and all of that. Now this is to ensure she's all right. This is to ensure she's okay. And also the doctor would examine the weight of her weight. They will take her blood pressure, they will check her blood, urine, just to see that everything is fine, you know, after the process of childbirth. And also the baby is going to be examined as well to ensure that he or she is doing well and growth is normal. Okay, there are no abnormalities after the 6 months. Now sometimes when people go for postnatal, that's when they found out that, oh, something is wrong. Oh, the baby's eyes are going yellow, and then the new mom is not even aware, and the doctors will have to put measures to see that everything is fine. So it's very important that after putting to bed, you go for postnatal care as well. Now the mother also can be advised on ways to take care of the baby, how to take care of herself, feeding, exercise, etc., etc. And also they would advise her on how to go for her baby's immunization and vaccination for that period. Now immunization is very important, not to miss any at all. And also family planning. Okay, doctors would advise her on family planning. Okay, how to space her babies if she's a new mom to have other babies. Now it's a little bit stressful to have a baby and another baby will be on the way almost immediately away. So you're going to be advised on how to do what family planning, so you don't just have a baby almost immediately after having a baby. Now, what are the important points about postnatal care? Now, the nursing or lactating mother should be able to have enough rest. Have enough rest. After you put to bed, make sure you have enough rest. This is very, very important. Now, I had an experience when I was pregnant. You know, I wasn't resting all through the day. And in the middle of the night, when it's almost like 11, 12, I won't be able to produce breast milk. And I'll call my doctor. I'll be like, what's happening? And then he will ask me, did you rest during the day? And of course, my answer was no. But when I started resting throughout the day, and that issue stopped, you know, because at some point, baby will be crying, there's no breast milk, and then I noticed that he just asked me that question if I usually take rest during the day, and my answer was not in the affirmative. And of course he said you have to take rest because it will tell, because baby was taking a toll on me as well. And when I found time to rest, when baby was resting, that stopped. Now you have to keep clean. Stay clean always, keep clean always, because you're going to be nursing the baby and baby is going to be suckling, so you have to be clean always. Now give the child necessary immunization at the right time. At the right time, you need to do what? Give the child the right immunization. Don't say, oh, if you go to the hospital, they give you the day to go. Make sure you go that day. Don't skip days. Don't skip days. It's not okay. Feed very well. Take care of yourself. And take balanced meals and also extra nutrients. Okay, So let's look at baby layette. Now, baby layette is the complete set of clothes required by a newborn baby. Now, the complete set of clothes required by a newborn baby is referred to as baby layette. Now, the baby's layette, or at least part of it, should be provided before the baby's arrival. Now, you need to put some things in place. Now, how do you protect the baby's layette, or what are the uses of the baby's layette? Is to protect the baby, to keep the baby warm, to keep baby comfortable. That's all the clothing. That's what it is referred to protect the baby, to keep the baby warm, to keep baby comfortable. Now, to keep baby comfortable, what are the suggested layers for a baby? Now, 2 or 3 dozen napkins for those persons that are still using napkins. You know, I said earlier, a lot of people don't know what napkins are. Napkins were washed. You know, they used to be very soft, absorbent, and then that when the baby uses, they wash them. Okay, it's reusable. You have to use them again. Okay, and then you keep them to dry. You need to have dozens. So if you're using disposable diapers and all of that, maybe Pampers that are also available, you can use them. Get them in dozens, and also 2 or 3 special napkin safety pins. Or for fastening the napkins, that's if you're going to be using napkins. But if you're using your disposable diapers, you don't have need for that. Okay, now a lot of you be wondering what I'm saying because you don't have an idea of what it is. Okay, so this was a cloth-like thing that was used to wear on babies, and then they use the pins to fasten the napkins. Now also the baby layers consist of 4 vests. You should have vests in them. These are under shirts. Okay, they should be comfortable and easy to put on and to take off. Then also 3 to 4 plastic pants. Okay, they should not be tight for whatsoever reason. They should be beatable or perforated plastic pants to do what? Make the baby feel comfortable. Also 2 or 3 nightgowns. Now these should be loose and long enough to cover baby's feet. Then 3 dresses and suits, you know, as much as you can to give the baby. Then sweaters. So all of these are referred to as what? A baby layers. Now, for baby's cots, after baby is back home, okay, the things that you're going to be needing for the baby's cot, that's where baby is going to be sleeping. Okay, you need about 2 to 4 bed sheets, then 1 or 2 blankets for the baby, then 1 large plastic sheet, and then also you'll be needing mosquito net. Very, very important. You can't expose baby to what? Mosquitoes. We have a whole lot of them here. So baby must sleep in what? A treated mosquito net, or a net that is for their age, and in there, so they will not be bitten by what? Mosquitoes. Then finally, for baby's birth, you need to take care of that. You need to have 1 large towel. You need to have 1 small towel. You won't use the same towel you use for the body for the face, and then as a 1 face towel, small towel, and a large towel as well. So after cleaning, you can be able to use the large towel to wrap the baby. You can get your bath and all of that. You know, taking care of little babies can be very fun, and they're very fragile at that point in time. So you need to pay close attention. So when you're carrying them, and then you don't trip and fall and hurt them. So let's go to Examguide and practice some of the questions we have learned for today. Okay, let's look at this question now. We talked about pregnancy and childbirth. So now let's look at, we said babies should be, they should visit the hospital after 6 weeks, but on the day of delivery, there's something that a baby is to be given. Now, the immunization given to a baby at birth is referred to as what? We have the quadruple vaccine, we have the measles vaccine, we have the BCG, we have the polio vaccine, we have the DPT. Now, BCG is the first vaccine that is given to a child at birth. BCG is given to the baby at birth when the child is born. So it's called what? BCG. Okay, let's look at this question. Which of the following tests is not carried out in an ante-natal clinic? Which of the following tests is not carried out in an ante-natal clinic? A, we have blood. B, we have abdominal examination. C, we have liver function. D, we have blood pressure. E, we have urine. You know, we talked about the procedures in what antenatal care and what they do there. Now, which of these is not carried out? Of course, every other one, they do blood, they check the abdominal examination, they check the blood pressure, they check the urine, but they don't do liver function there. So this is the answer. Liver function is not carried out at an antenatal clinic. Okay, let's look at this question. The following are the advantages of prenatal care except the advantages of prenatal care except A, the unborn baby is examined. B, mother receives continuous supervision. C, mother is advised on layers and diets. D, medical treatment is given to mother. E, baby is given immunization. The following advantages of prenatal care except the unborn baby is examined. Prenatal, don't forget the word. Make sure you take note of the question. Prenatal, that is, prenatal is before the birth of the baby. The unborn child is examined. Mother receives continuous supervision. Mother is advised on layers and diet. Medical treatment is given to mother. Baby is given immunization. Okay, so baby is not born yet, so that's not a prenatal care. It's when baby is born, that's when there's a postnatal and baby can be given immunization. So you understand. So the following are advantages of prenatal care except baby is given immunization, because baby is not born yet. So this is the correct answer. Baby is given immunization. Baby cannot be given immunization when the baby is still in the belly. Okay, all right, so that is the correct answer. So I think let's stop here for today. Thank you.